Hello everyone. I am Shilpa Mohanan from the Academy of Online Radiology Education. I work at University of Arkansas for Medical Sciences at Little Rock, Arkansas. This month, I would like to introduce you to a few interesting articles in musculoskeletal radiology. Before moving to that, I would like to thank my senior editors, Dr. Avnish Chabra, Dr. Kedar Jambekar, and Dr. Manikam Nix Kumaravel for their contributions to this blog. First one, this is a systematic review and meta-analysis on superolateral Hoffa's fat pad edema and patellofemoral maltracking. 9 studies which met the criteria of comparing patients with and without superolateral fat pad edema and evaluating patellofemoral maltracking parameters on MRI were included in this. The conclusion was patellofemoral maltracking imaging parameters such as a more laterally displaced patella, greater TTTG distance, and patella alta are correlated with superolateral Hoffa's fat pad edema. Quantitative variable assessment of patellar instability, an MRI-based study. So this is a retrospective study. The study population was composed of 43 women and 57 men with mean age of 21.7 years. Who received both a clinical and an MRI diagnosis of a patellar dislocation event at a single institution from 2013 to 2015. The conclusion was the TT-PCL, TTTG, and trochlear dysplasia measurements can be reliably evaluated on MRI with almost perfect intra and inter-observer reliability. The normal cutoff thresholds for both TTTG and TT-PCL on MRI can be lowered. The study confirmed 5 mm or greater as a normal cutoff threshold when evaluating trochlear dysplasia via trochlear depth. Finally, the prevalence of tibial tuberosity lateralization and trochlear dysplasia is significantly higher in patellar instability population. And trochlear dysplasia is the most important factor in the development of patellar instability. Use of advanced imaging for radiographically occult hip fracture in elderly patients, a systematic review and meta-analysis. So this was a meta-analysis of 35 studies. The studies were included if the patients were clinically suspected to have hip fracture, but there was no radiographic evidence of surgical hip fracture. The conclusion was elderly patients with acute hip pain and negative or equivocal findings at initial radiography have a high frequency of occult hip fracture. Therefore, the performance of advanced imaging, preferably MRI, may be clinically appropriate in all such patients. So this is a systematic review and meta-analysis on the diagnostic accuracy of limited MRI protocols for detecting radiographically occult hip fractures. Original articles with 10 or more patients. Evaluating the MRI protocols for diagnosis of radiographically occult proximal femoral fractures compared with multiparametric MRI with or without clinical outcome as the reference standard were included in this analysis. And the conclusion was limited MRI protocols can be used as a standard of care in patients with a suspected but radiographically occult hip fracture. A protocol composed of coronal T1-weighted and stir sequences is 100% sensitive. So this is a prospective diagnostic test accuracy study on dual energy CT for suspected radiographically negative wrist fractures. Adults with wrist trauma referred for MRI were eligible if they had a relevant trauma history and negative or inconclusive findings on radiographs but a clinical suspicion of fracture. Wrists were examined with dual energy CT and MRI, and images were read by 4 readers who were blinded to clinical information. The presence of bone marrow edema and fracture was rated per bone. The conclusion was dual energy CT had a high sensitivity and moderate specificity in the detection of bone marrow edema of the wrist. Dual energy CT had high sensitivity and specificity in detecting fractures of the wrist in patients with suspected wrist fractures and negative findings on radiographs. Predicting bone marrow edema and fracture age in vertebral fragility fractures using MDCT. This is a retrospective study. A total of 189 thoracolumbar compression fragility fractures in 103 patients imaged with both spine CT and MRI were included. On CT, 5 features, that is the presence of cortical or end plate fracture line, presence of trabecular fracture line, presence of condensation band, change in trabecular attenuation, and width of paravertebral soft tissue change were analyzed. The conclusion was CT features accurately correlate with the presence and extent of bone marrow edema in vertebral fragility fractures. Elevation of trabecular attenuation was the only significant image predictor of fracture age. Quantitative magnetic resonance imaging ultra-short echo T2 star mapping of tendon healing after arthroscopic rotator cuff repair, a longitudinal study. This is a cohort study. The ultra-short echo T2 star values have been shown to be sensitive to biochemical collagen matrix changes. The UT-T2 star mapping technique has been applied to explore the biochemical alterations of tendons during healing. A consecutive series of patients, a total of 25, with supraspinatus tendon tear who was scheduled to undergo unilateral arthroscopic rotator cuff repair at the sports medicine department between 2015 and 2017 were included, and all lesions were confirmed using arthroscopy. The conclusion was this study indicated a healing related relationship between clinical outcomes and quantitative ultra-short echo T2 star values, which highlights the potential of using UT-T2 star mapping to track the tendon healing process non-invasively. Moreover, the repair tendon was comparable to age-matched healthy controls at 12-month follow-up based on ultra-short echo T2 star values. Imaging of the degenerative spine using a sagittal T2-weighted DIXON turbo spin echo sequence. This is a retrospective cross-sectional observational study. 35 patients with lumbar back pain were included, and they all had sagittal T2-weighted DIXON as well as non-contrast T1-weighted sequences available, covering the complete lumbar spine. The conclusion was, in patients with low back pain, MRI using a sagittal T2-weighted DIXON sequence and no separate T1-weighted sequence might be sufficient to accurately detect common degenerative changes with high diagnostic confidence. Sparing dedicated T1-weighted sequences can considerably reduce overall scan time. Influence of acromial morphologic characteristics and acromioclavicular arthrosis on the effect of platelet-rich plasma on partial tears of supraspinatus tendon. This is again a retrospective cross-sectional observational study, and the patients with partial supraspinatus tear smaller than 1.5 cm referred for ultrasound guided PRP infiltration for shoulder pain lasting more than 3 months were recruited consecutively to this study. The conclusion was, with isolated partial supraspinatus tears smaller than 1.5 cm, the presence of type 3 acromion or severe acromioclavicular arthrosis is predictive of unfavorable results. An acromioplasty must be contemplated in them, whereas in patients with type 1, 2 or 4 acromion with or without mild acromioclavicular arthrosis, PRP therapy should be regarded as one of the first therapeutic options. Optimal choice of ultrasound-based measurements for the diagnosis of ulnar neuropathy at the elbow, a meta-analysis of 1,961 examinations. So this was a meta-analysis of 19 studies which had 1,961 examinations, evaluating the diagnostic accuracy of ultrasound of patients with ulnar neuropathy at the elbow before April 2019. The conclusion was measuring the cross-sectional area and not diameter of the ulnar nerve, measuring at the level of the medial epicondyle and not proximal or distal levels, and using a cutoff value of 10 to 10.5 mm square is recommended for the diagnosis of ulnar neuropathy. Ultrasound measurements can be performed in any degree of elbow flexion. Maximal nerve diameter, maximal cross-sectional area, and nerve ratios cannot be considered optimal methods for the diagnosis of ulnar neuropathy at the elbow. So that's all we have for this month. Thank you for listening. For more information, you can read our blogs where we have given the links to these individual articles. Thank you.